Hi, so for our project, we chose to talk about ischemic strokes, which is a type of stroke that's caused by the blockage of an artery that supplies blood to the brain. The blockage reduces the blood flow and the oxygen to the brain, which leads to damage or death. We wanted our patient to have their left side of their brain affected by the stroke, which would mean that their symptoms would either have their right side weakness or paralysis and sensory impairment, problems with speech and understanding language, visual problems, including the inability to see right visual field of each eye, impaired ability to do math, organize, reason, or analyze items, behavioral changes such as depression, cautiousness, and hesitancy, impaired ability to read, write, or learn, inability to walk, and problems to coordinate balance, dizziness, headaches, nausea and vomiting, memory problems, breathing and heart functions, body temperature control, balance and coordination, weakness or paralysis, chewing, swallowing, speaking, or vision. So our patient has problems with their upper extremity. We wanted their right shoulder and their elbow to be affected after the stroke. So I found this article that talks about strokes in the upper extremity. This one talks about the changes in the upper extremity and the functional capacity doing daily performances after strokes. So this article mentions that 65% of people can't use their hand in daily activities afterwards, and that 57% of people discontinue actually doing their meaningful activities. We had a patient who was Marie do a ADL, which was shampooing her hair, and this stuff afterwards, which was like brushing it and blow drying it after having her stroke. And although we didn't make her paralyzed, she just had weakness in her arm, so she couldn't fully do the movements without being in any sort of pain. And this study of an article, there had 15 participants that had upper extremity paralysis after their stroke in the outpatient occupational therapy setting. The upper extremity motor capacity was measured using the action research arm test, and the upper extremity performance was measured using bilateral wrist-worn accelerometers. The measurements were taken at near or start of therapy every 10th visit or every 30 days throughout the duration of services and when they were discharged. Using the action research arm test, they found 3 patterns of during their studies. So one was that the scores were normalized, which means that the capacity and performance of the upper extremity was improved. The second pattern was that increased scores, but no change in the accelerometer profiles, which shows that the functional capacity of the upper extremity was improved, but there wasn't any change in the performance. The third pattern was that the participants showed no change in scores, which means that the functional capacity of the upper extremity and the performance of the upper extremity was showed no improvement. So that was just the article that I found.
Evidence-based article using the biomechanical frame of reference discusses interventions for an upper extremity disorder. In the article, it proves how limitations and pain can disrupt a person's ADLs. Evidence within the article shows that occupational therapy intervention can decrease pain, improve range of motion, as well as strength, endurance, and overall function of the upper extremity.
Hey Marie, my name is Joel and I'll be your therapist today. How are you feeling?
I have some pain in my shoulder and weakness in my right arm.
Yeah, I see in my charts here today that you had a stroke. So you said your right arm is hurting. What else have you not been able to do afterwards?
Sometimes trouble swallowing, but it's mainly just weakness in my arm, my right arm.
And So today in our session, we'll be working on the biomechanical frame of reference. I think that'll benefit you the most to work on your ADLs. I see here that you said that you want to work on washing your hair at home more. So I think we will work on your upper body extremity strength and your endurance today. And with that being said, we'll stimulate washing your hair inside your bathroom in your shower. Okay, Marie, so you said that your upper body is hurting?
Yes, my shoulder, my arm is a little bit weaker.
So with this side, I'm going to ask, are you able to get over into the shower fine?
Yes.
Okay, so you have no problems getting over the shower? Your right side of your body and using your arm, your weaker arm, are you able to go ahead and try to rotate the faucet head or the knob?
Yes,
doing
it's
that
a little
fine?
sore.
So Marie, with your weaker arm, can you try to grab the shampoo bottle? Does that hurt?
A little bit.
Are you able to squeeze it?
Yes.
Okay. Can you put it back down? Does that hurt when you're lifting it like that?
Yes, it's a little heavy.
Have you practiced the motions of massaging your scalp like you were washing your hair?
This arm doesn't go up.
You
too
can't
high.
move it?
It's sore. It's a little bit weaker.
Okay. Can you try to move it as high as you can?
Just probably about as high as I can get. Like this, I can go up.
Okay. Okay, can you just move it down so it's not?
Mm-hmm.
Okay, Marie, can you plug in the blow dryer for me? And when you press that in, was that okay with your arm?
Yes.
Okay. And then with your weaker arm, are you able to hold the blow dryer?
It's a little heavy.
Can you lift it up to blow dry your hair?
About right here.
Okay. You can put it down. Are you able to lift up the comb that's lighter?
Yes.
Okay, you no problems with that? Do you want to practice the motions of maybe combing it?
Combing.
That's okay?
Yes.
Okay.
As long as I stay right here.
Okay.
And this one I can go higher.
Okay, you want to unplug it?
Yes.
So our session is over today. How do you feel after it?
I feel okay. I just want to be able to increase my endurance and be able to hold weighted objects like the shampoo bottle and the hair dryer.
Yeah, I saw that you were just struggling just a little bit, but I think with a few more sessions, you should be fine and you'll be back to the way you were. I think with maybe a few more weeks, you'll be back with your full range of motion.
Okay. Sounds good.
Thank you.